I want to give you a how demonstration of Green Self. One things we do is we have a license to an amazing clinical patient engagement program. But one things we do is that we have care engagement pods that enable services for the patient, like Thomas. He's a health coach, nurse, educator. These care enable pods are developed primarily with care enabled technology. They get at home monitors like glucose and blood glucose monitors. And so I want to quickly show you this. One of the issues we have is that our patients is um, there's some EHR data to show you how the dashboard works. But one key area that I want to show you is overall demonstration of how things work on our end. So here's where we get overall dashboards such as alerts, interactive communications, and things of that nature. And we can see how many patients we have active. Currently, there's 15. And then our patient list, I'll just show you. So I just clicked on my patient list. And one of the things that we see is who's compliant, who's not compliant. So we can see this patient here is in orange. She's very close to getting compliant in terms of reading compliance at 78%. And then you can see out there her days when she's compliant, not compliant. And next thing I want to show you is the care enable piece of what we're doing. So in our care enable piece, we have the care enable team like Naj and ISIS calling and experimenting. Hey, what's the reason for the call? What's the reason for the alert? And this process is where the magic happens to keep our patients very, very engaged. And so this is just a test patient here, but we can see if we need to update care monthly plan or if we need to see when it's created by in terms of what we focus on the care enabled patient. And most importantly, what this helps us focus on is actually getting reimbursed every month. One of the things I wanted to end on for this care enabled pod, just to give you just how everything works, is our reports. So every month we're getting reports on who's getting billed, who's not getting billed, that whole nine. So give it a second to load up. So you can see how many patients we have active. And most importantly, the reason why we have the care engagement pod is at home monitoring, how many billing codes we have for this month, and also CCM metrics, how many billing codes we have for this month as well. It's like we're trending very well 99490. The next thing I want to focus you on is what IP that we're focused on creating is a digital twin to model who's going to be engaged and who's at high risk. So this is where our research is going to. It's called the physiologically constrained neural network design. We're in partnership with our lead AI specialist, Clara Mascara. And so once we have all this data from the monitoring systems like a CGM or continuous glucose monitor, we'll focus on predicting the population level, but also individual level glucose response. And this is open source version. We have our own closed source version that we're building as well. But in a sense, what the clinicians, Naj and ICE will be able to see as this patient is reporting what they're eating and also their responses, we'll be able to see exactly what's going on with their blood sugar spikes, but more importantly, predict future blood sugar spikes to help create a personalized care plan for the patient. We see the EHR process, what you saw earlier, those have already been done and tried, and we're focusing on the next stage of precision medicine and precision healthcare of digital twin creation and being as personalized as possible. And I just want to end off on our core business models that we're focused on testing in terms of the product that we focus on generating. Why we have to use EHR and why we're creating our own digital twin is because there's a regulation part of what we're doing, and we decided to skip over that process and focus on getting reimbursed. And in phase two of what we're doing, we can double down and create our own, precision platform. But it's all about hitting medical nutrition therapy codes with nutritionists, chronic care management codes with our nurses, and as well as remote patient monitoring codes with at-home devices that are cellularly enabled. All right, thank you.